Hello, I'm Karla Robeson, and welcome back to Optimal Healthcare's second session of Let's Talk About Health. I'm here again with our very own Dr. Jacob Minang, and he's answering questions for us about this COVID-19 pandemic and giving us some really good scientific information that I think all of us could use. Last time we ended with questions about remdesivir. And today I want to start with a continuation of that thought. When some of our more powerful politicians have become ill or their families have become ill, they have received a medication that, if I understand correctly, is not fully available to the general public. Are you familiar with that medication? I believe it's an antibody medication. Please correct me if I'm wrong and let me know what you know about that.
Okay, so as part of the work to develop medications against the virus, while some companies were working on chemicals that can directly block the virus or prevent viral enzymes from promoting viral replication, some other companies were working on human-type antibodies that directly target elements of the virus. In this case, the spike protein that the virus uses to be able to bind and insert itself into cells. So there are two companies at the forefront of this. There's Regeneron and then there's Eli Lilly. It's essentially the same antibody. It's the same sequence. The other things that actually are different, but it does the same thing. They only recently got emergency use authorization, which means that the antibodies are still under testing in a sense. But because they have been shown to be effective on a few patients, they think that it is worthwhile, given the emergency, to try that in the clinic for people with early symptoms that have underlying conditions that show that they might potentially end up with very severe disease. And you want to hit those people with the antibodies early, within the first 10 days of diagnosis. The earlier, the better, because it takes at least 10 to 14 days to develop a primary immune response. But we know that those immune responses sometimes are the reasons why people end up with exaggerated responses and they get very sick. So if you can give them these antibodies early before their response actually come up, then it might be very beneficial to them. But again, as I said, these antibodies are still under testing.
So these are not, these antibody medications are not things that are going to be available to the general public anytime really soon, is what I'm hearing.
No, that's not the case. You'd be surprised. There are more than 25,000 doses of these antibodies that have been delivered to hospitals across the country by both companies. From a few anecdotal conversations I've had with people, there are two issues going on. Some of these hospitals, they made the mistake of keeping their antibodies with infusion centers that tend to close over the weekend, which means that if you needed this antibody and you showed up on a Friday evening, they'll tell you come back on Monday to get it. And meanwhile, you need it immediately. And I've been reading some scientific articles that are showing that less than 25% of these antibodies have actually been given out to people. So there's actually a lot of it out there, people are just not aware. And the government already prepaid for it, so it's supposed to be free. If you show up at an emergency room and you're proven to fall under the category of patients that will potentially have complications, you have a right to be given these antibodies immediately at diagnosed.
That's very good information to have. Thank you. I think we all need to have a discussion with our doctors about whether or not this is something, if we become ill, if this is something that we should advocate for.
Immediately you have symptoms and you confirm that you are infected and you fall within the group of individuals that are of high risk of complications, you should ask your physician for them to prescribe for you to get a medication immediately. But even if you show up at the ER on your own, if they have the antibodies, they're supposed to give it to you as soon as possible. The issue is that some ERs don't have it. They instead have it at infusion centers, which maybe also makes sense because this antibody is administered as an infusion. So you have to be prepared for between an hour to 3 hours. And they have to also plan to be there for an extra hour just in case you have side effects. That way they can monitor you before letting you go home.
So this is not handled as an inoculation. It is actually handled like an infusion.
Yes.
That is very interesting. I didn't know that.
Right. Absolutely.
Thank you. So, one of the questions I keep hearing as well is some of these vaccines have to be kept at temperatures that are lower than I've ever even heard of. And some of them are more stable at normal freezing temperatures. Why the difference? And why on earth do they have to be kept so cold?
Okay, so there are three vaccines that have been approved now, two in the US and all three in Europe. The two in the US are vaccines that were approved from Moderna, which was the second one, and Pfizer, which was the first one. The common thing about these two vaccines is that they are made of messenger RNA molecules. Messenger RNA molecules are very fragile. They can easily break down. And if they find themselves in any environment where you have living organisms, most living organisms produce enzymes that will break down RNA. These enzymes are called nucleases. But those enzymes are not effective at very low temperatures. So the first concern is that the RNA might be broken down pretty fast. They are packaged in lipid nanoparticles, so the lipid should potentially protect them for a little bit. But the role of the lipid is not really to protect them, but to make sure that they're able to get into cells.
Okay. So I guess what I'm wondering is if they have to be kept so cold and then they're injected, are they injected cold? Do they, I mean, what is the mechanism for making sure that it gets from that freezing temperature into your body safely and doesn't break down in the heat of your internal body?
Okay, so again, the concern is not heat. The concern is enzymes from any living organism, nucleases, breaking it down. So to administer it, they can be thawed and kept at room temperature for up to 12 hours for the Moderna vaccine. For example, for same thing with Pfizer. I think the Pfizer within 2 to 4 hours. So just enough time to be able to use the one vial they're taking at a time. And one vial has more than enough vaccine for 10 doses. So as soon as it thaws, within 2 to 4 hours, you use up that vial and then go to the next vial. Yes.
Okay. So, how are the vaccines from these different companies? Now, you mentioned that there were three different ones. How are they different? Are they all based on RNA? Or are they each a little bit different?
Okay, so I was going to get to that. So the two that have been approved in the US are both messenger RNA based, and those have also been approved in Europe. This week, the UK approved a second vaccine that is not messenger RNA based. It's based on using a co-virus, but this time not a human co-virus, but a chimpanzee co-virus that is known not to be infectious or pathogenic in humans. And then the sequence of the spike protein of COVID-19 is inserted into that co-virus. So you are literally given a live virus in this vaccine, so that when the virus uses its regular mechanism of infecting your cells, it's going to make your cells to produce those viral particles together with the spike protein of COVID, so that when your immune system sees the COVID spike protein, you're going to produce antibodies against it as well as develop T and B cells. So if you see the virus itself down the road, you're going to be protected.
Well, thank you so much, Jacob. This has been very informative, and you can bet I'm going to have some more questions for our third session. I look forward to seeing you then. And thank you, everyone. Please join us later for our third session.